Is the ongoing lockdown responsible for a noticeable rise in domestic violence, as being reported on the mainstream as well as social media? Some persons have been pushing the arguments to the effect that it's only natural that there would be a spike with victims being trapped at home with their abusers because of the no movement guideline. Now, of course, we have to have a closer look at this, so we're now being joined by Dr. Kemi Dasilva-Ibru, a medical doctor and also founder of the Women at Risk International Foundation, WARIF. Welcome to the program, Dr. Dasilva-Ibru. Thank you so much for joining us.
Good morning, Dr.
Thank you very much. Good morning. Thank you for having me.
You're welcome. Well, quickly, let me ask you, is it really true that COVID-19 has resulted in a rise in gender-based violence in Nigeria in particular?
No, absolutely. This is actually a global phenomenon beyond Nigeria. I mean, when you look at the COVID-19 pandemic, and then you appreciate that over 90 countries to date instituted a national lockdown as a result of trying to stem the transmission of the virus into the community. What you now have is countries where groups of women that ordinarily would have had some sort of recourse and safety being out of the home are now forced into quarantine with their abusers. And as a result of the increasing intimate violence that we see in these homes, we're seeing reported cases that are increasing every day.
Certainly, cases are increasing every day. Like you pointed out, it's not just in Nigeria, but all over the world, there has been a spike in gender-based violence. Now, Dr. Kemi, I wanted to ask you, do we have any statistics, bringing it back to Nigeria, are there any statistics on the spike that we are seeing in GBV since the lockdown started?
So presently, this is an ongoing event. This is an event that's being tracked, again, globally. In Nigeria, we are having more and more organizations, as well as state governments, like Lagos State, collating data as we speak. At the organization, what we have been able to do as a result of having a 24-hour confidential helpline manned by social counselors, we've noticed a 64% increase in the call rate since the COVID pandemic began. And 72% of these women are women that are trapped in homes with their abusers.
Well, Doctor, let me ask you, let's talk about Women at Risk International Foundation. What is your group doing in terms of helping to protect people who are at risk with regard to gender-based violence? And what do you see? Is it only women that are at risk? How about men also, who may find themselves in abusive relationships made worse by the lockdown?
So WARIF is an acronym for the Women at Risk International Foundation, and the organization was established to address the prevalence of rape, sexual violence, and trafficking of young girls and women in communities across Nigeria. And this we've done for over 3 years now. Our approach is very simple. We implement impactful initiatives that are measured. We work under 3 pillars: the health pillar, the education pillar, and the community service. Over the last 3 years, we have a rape crisis center that we've opened in Yaba, and this is a walk-in facility. We offer free services. We have forensic care, we have treatment, we have HIV testing, and then we have counselors to start the process of emotional healing. The other thing that we've been able to do is implement social wealth. A big part of the care that is needed specifically in this part of the world, where we're not exactly a socialist country. So when women come to visit us, we're able to then address their social needs, whether it's accommodation, legal aid, or vocational skills. And all of these services we offer free of charge. So since the COVID pandemic, and since we've noticed that with the national lockdown, the cases are increasing, what we've been able to do is, in spite of the restricted movement, we've been able to stay open. And by staying open, we represent a beacon to many women that are aware of our services and they can make their way to our center. We also have a 24-hour confidential helpline. The helpline is manned by trained counselors. And so we're able to start the process, offer counseling, or even practical information that many of these women are not aware of. Nowadays, especially with young women and college students, the social media platforms and the blogs are also an area where a lot of girls are able to send messages to us via, the direct messaging service to, complain about whether or not they're in a home of abuse. Another aspect that we're noticing, in addition to women at risk, is children, because many children have used school in the past as a refuge. And so that day girl that typically would leave home, spend her day at school and perhaps find an excuse to stay out of the home because it's a home of abuse, has no choice now but to be locked in with her abuser as well. Ruben, you asked about men. Yes, we've had a 28% increase in call rates from men because men are survivors of gender-based violence as well. A lot of times when we say gender-based violence, we interchange that with women or with violence against women. But this violence certainly cuts across both gender.
Dr. Dasilva-Ibru, you've pointed out some extremely dark statistics here, and I'm glad that we're talking about both the increase in gender-based violence that is happening to both women and men. Now, a 64% increase in the call rate and a 72% increase in those trapped at home with their abusers is not a joke at all. And it's amazing that the foundation has found a way to stay open during this period. But I'm sure as a foundation, you're also facing some challenges by staying open to care for survivors of gender-based violence. What sorts of challenges are you currently facing? Access to PPE, etc.?
Absolutely. So the main challenge, I would say, is access to the personal protective equipment that we need. As frontline workers, seeing women from the community, we're examining women, we're drawing blood, and so it's necessary for us to protect ourselves. Another important aspect is making sure that we don't cross-contaminate, because we're seeing women that are coming from the community and returning back into this community. The other challenge we've had is transportation, the restricted movement. I mean, a lot of times we have women that call in and say, we would like to come in, but unfortunately we can't get to you because of transportation logistics. And even with the staff, ensuring that the staff are able to get to the center in a timely fashion and stay during the course of the week is also an aspect that we've been finding challenging. But I must add, though, in spite of the challenges of transportation logistics, I mean, in the course of 1 week, we saw over 10 survivors. So these are women that, the fear that they're challenging. But I must add, though, in spite of the challenges of transportation logistics, I mean, in the course of 1 week, we saw over 10 survivors. I must add, though, in spite of the challenges of transportation logistics, I mean, in the course of 1 week, we saw over 10 survivors. I must add, though, in spite of the challenges of transportation logistics, I mean, in the course of 1 week, we saw over 10 survivors. I must add, though, in spite of the challenges of transportation logistics, I mean, in the course of 1 week, we saw over 10 survivors. I must add, though, in spite of the challenges of transportation logistics, I mean, in the course of 1 week, we saw over 10 survivors. I must add, though, in spite of the challenges of transportation logistics, I mean, in the course of 1 week, we saw the challenges of transportation logistics, I mean, in the course of 1 week, we saw the challenges of transportation logistics, I mean, in the course of 1 week, we saw the challenges of transportation logistics, I mean, in the course of 1 week, we saw open. We have to ensure that they do have the PPE, like we discussed, and that they're available to assist when these women visit. Then we have the community. Everyone has to be a brother or a sister's keeper. We have to appreciate that it's now that we need to check on our loved ones. We all know of the neighbor that perhaps is suspicious. Now is the time to make that phone call to inquire on the well-being of that woman and her family member. And I think if the woman herself, very much aware that she's in a home of abuse and she's at risk, she needs to have a safety plan. She needs to already have an idea of who to ring, who's that supportive family member, who's that supportive friend that she can call on now for assistance. She needs to ensure that she has some money put aside, and this is unbeknownst to her abuser. She needs to have an exit strategy from the home whenever this violence escalates and she needs to leave the home place. And then she needs to be aware of the hotlines, like the 24-hour confidential worry line, for instance. We have other organizations that also have helplines, as well as state government. She needs to have those lines on speed dial so she can immediately call when these incidents occur.
Certainly, Dr. Dasilva-Ibru, that's a great point to make. Having these hotlines on speed dial, the DSVRT, WARIF, etc., and all of that information, I believe, can be accessed online to viewers who may be interested in looking for those numbers. Now, Dr. Dasilva-Ibru, you're a doctor, so it will be great to get more insight with regards to the COVID-19 situation as a whole and how you feel Nigeria has responded to the situation. I'd like to take one state in particular that's of great concern to a lot of us right now, which is Kano State. The sudden increase in deaths in Kano State over the past week, I believe there have been over 600 deaths unaccounted for, that have people extremely worried. Symptoms that are very similar to that of COVID-19, hypertension, diabetes, etc. Malaria is being stated as one of them too. What is your take on what is going on in Kano State that some medical analysts are saying may actually be the epicenter of the virus in Nigeria?
I think, as with many states and many countries, this is an ongoing event. This is a virus that's evolving. As medical practitioners, we do have a general blueprint in terms of the epidemiology of the virus. We're very much aware of the safety precautions that we're insisting that everyone, ensures that they're carrying out. And we also have a pretty good idea of the symptomatology and, when we see patients, the types of signs that we look out for in terms of identifying whether this virus is present. But then another aspect is understanding that, there are changes that are occurring on a daily basis. With regards to Kano, I don't know whether it's a function of increasing cases or just better reporting and tracing, because I know more and more many states are, implementing more contact tracing and implementing more tests in many of their communities to identify, areas and hotspots that are at risk. I think, personally, in my opinion, we're not at the apex yet. I believe that, the cases see a bit more of a climb before we actually reach the apex and then perhaps start to see a flattening out.
Well, Dr. Ibru, earlier on you referred to helplines. I don't know whether you have those helplines that you would like to share with our viewers, because those helplines are really very important. I mean, in France, there is a code word. You just say mask 19, and or you text a message to 114 in France. They have a similar system in place also in Spain. So if you have those helplines, it would be nice for you to share with our viewers. And then I'd like to ask you, I mean, rape is easy to identify. Physical assault is easy to identify in terms of, when someone becomes a victim. But how about persons who are emotionally abused? And you will not see any sign of physical trauma, but theirs is a case of emotional abuse. How do women at risk deal with that?
So with regards to the helpline that you mentioned first, Ruben, we do have a 24-hour confidential helpline. The number is 0809-210-0009. I'll repeat that. It's 0809-210-0009. The other aspect that you asked with regards to the emotional trauma, yes, indeed, this is, again, a large issue that we're dealing with, because when you deal with violence against women, naturally, the first thought that comes to mind is physical violence. But the emotional aspect is just as important. At the center, we have trained counselors and psychologists that actually sit with women that visit the center, and we carry out either individual sessions, and we also have monthly group sessions for women that are survivors of sexual violence. The issue of reporting cases of sexual violence is not one that is commonly seen in our environment, because it's still pretty much, regarded as a stigma. And so a lot of times it's shrouded in secrecy. I mean, the families are more concerned with the hypocrisy of the family name than the woman actually coming forward to make a claim that this is happening to her in her home. So women are not allowed a place where they can speak their truth, and they're not giving platforms where they can speak out. And so having emotional therapy, having counselors that you can speak to, is an important way of starting the healing process.
Certainly, Dr. Dasilva-Ibru, it is an important way of starting the healing process, and emotional abuse is often left out, like we have pointed out, and it has to be addressed because it is something we see all the time. Now, Back to the topic of gender-based violence and the lockdown in particular. Now, this morning on the show, we've been discussing the possible extension of a lockdown, the easing of a lockdown, and here we are also discussing the increase in gender-based violence cases since the lockdown started. What is your take on the lockdown as a sort of cushion to ease the effects of COVID-19? Do you think that the lockdown is working? Do you think we need to ease the lockdown, and particularly in terms of gender-based violence?
I think the lockdown as a protective measure is a valid, intervention. The whole idea of the lockdown is, if there are less people in the community, there's a less, if you will, incidence of transmission within the community. The challenge, however, is, as you rightly said, we're in an environment where there's certain areas where we don't have a luxury of lockdowns. We don't have the luxury of social distancing. We have a large informal sector that rely on daily earnings to survive. And so trying to explain to that group that they have to stay home, and you're weighing a disease that, yes, could potentially spread to them with their daily earnings and their survival, is a very difficult argument to make. I mean, with regards to the lockdown and gender-based violence cases, it's a huge concern. In spite of the fact that we don't have current data now, if we look at countries like South Africa that have comparable statistics to ours, where 1 in 4 girls before the age of 18 would have experienced at least one violent sexual encounter. By the 21st day of their lockdown, there were 87,000 reported cases. And we're up to day 28, so it's certainly a huge concern.
Well, Dr. Ibru, we have just about 2.5 minutes to go, but I would like to ask you, what's the bigger challenge that Nigeria faces with regard to gender-based violence? Is it culture? Because in some communities, it is believed that, it's in order for a man to beat his wife as a way of, disciplining her. Now, is it a problem of the law? Because Section 55, subsection 1D of the Penal Code of the northern states actually says it is legal for you to beat your wife for correctional purposes.
I think the challenges that we face with gender-based violence is multifactorial. I think also when you look at gender-based violence in the context of Nigeria, we do have our own peculiarities. As a patriarchal country, women are naturally subjugated anyway, regardless of whether or not she's actually under the thumb of an abuser. We also look at, as you rightly said, our cultural practices. We do have parts and communities in Nigeria where women are subjugated, and as you said, it's actually, legally and in a community sense allowed for you to physically abuse her under the auspices of being her spouse or her husband. I believe that the laws we certainly have enough laws to persecute and prosecute offenders. I think it's a question of implementation, ensuring that these laws are implemented.
Well, thank you very much, Dr. Kemi Dasilva-Ibru. Thank you for your insights.
Thank you very much.